Welcome to today's event on adolescent sexual and reproductive health. It is held courtesy of the Pharmaceutical Society of Kenya in partnerships with the Maristops Kenya. And today, it's on the 17th of November, on Tuesday, 2020. I hope you can hear me loud. You can hear me loud and clear. I wish to ask and request you from wherever you're listening us from, if you're able to hear us, kindly leave a text message. Leave a text message, a chat. Drop your chat and probably tell us where you're joining us from this morning. We apologize for the late beginning of our webinar today. We apologize for the late beginning of our webinar today. So, ladies and gentlemen, welcome all to this day's webinar. It's on adolescent sexual and reproductive health. A few ground rules and announcements to make. The participants are muted during the entire course of the webinar. All your questions shall be received via the Q&A tab at the bottom of your window, and questions will be addressed by panelists later in the program. For PSK members, if not already done so, kindly subscribe on the PPB portal for today's webinar so that you can get your CPD points. And that I have been assured right now that we are able now to subscribe onto the PPB portal. The event is on the PPB portal, so kindly subscribe. For KPA members and other cadres, the attendance list will be forwarded on request to your officials for awarding of the CPD points. A polite note to make: CPD points will only be awarded to paid up members, that is one. And this webinar is being recorded and shall be made available hereafter on PSK's YouTube page. Our moderator today is myself, Mbao Gitao. I'm the communication and events lead at the Pharmaceutical Society of Kenya. Ladies and gentlemen, I will not introduce our guests today evening. I will go ahead and give us the agenda. We will hear from our guests later on as after the presentation. Ladies and gentlemen, our agenda today, we begin at 7. We apologize for beginning 5 minutes late. And between 7:10, Dr. Michael Mungoma and Dr. Jill Mutua will take us over. And after that, we're going to have a small slide presentation by forgive me for that. We're going to have a slide presentation by the Maristops group, Maristops Kenya group. And after that, 8 p.m., we're going to have a 15 minutes question and answer. Kindly forgive me for that. So our speaker for today is Dr. Michael Mungoma. He's a member of. Kindly forgive me for that. Thank you. Our speaker for today is Dr. Michael Mungoma. He is the current dean at the School of Pharmacy, Mount Kenya University, a member of the PSK National Executive Committee. Our other speaker is Dr. Jill Mutua, a member of PSK. She holds a master's in clinical pharmacy, a 2002 with Charles University, that is Prague in Europe. She's currently working at Government of Kenya Nakuru Provincial Hospital. Now that is the Nakuru County Referral Hospital since the year 2008. Ladies and gentlemen, without further much ado, I kindly welcome Dr. Mike Mungoma to take it over to be able to guide us through the rest of the presentation. Dr. Mike Mungoma, are you with us?
Yeah, good evening, everyone. Thank you, Mbao. Thank you, Mbao, for introducing myself and Dr. Jill. We apologize for starting late, and we hope that Mbao, you are okay. Take a glass of water or 2 sips of water just to take care of that throat. So this evening, we want to talk about adolescent sexual and reproductive health. This is one of a series of topics that we are going to discuss throughout this month, courtesy of Mary Stops and the Pharmaceutical Society of Kenya. And these are topics again that I would say one are areas that as healthcare workers we really need to get involved in, and we need to increase our knowledge base when it comes to sexual and reproductive health. So before I continue, I want to make a disclaimer. The presentation I'm about to make may not include all the relevant facts or the most up-to-date research because it's quite wide and vast, and the presenter is not liable in the event that omissions or errors occur. Next slide. So we'll start with a few definitions and key facts. Adolescence. So the World Health Organization defines adolescents as individuals in the second decade of their lives and puts them in a bracket of 10 to 19 years. This is also defined by our national policy. The WHO also recognizes that adolescence is a phase rather than a fixed time period for an individual's life, a phase when enormous physical, psychological, and social changes occur. So adolescents are a very diverse group. They are in different stages of development, live in different circumstances. They also have very different needs and problems. An example is that a 13-year old boy, yeah, is very different as compared to a 13-year-old girl, even though they're the same age. And it could be that they could even meet in the same school and go through education together, but they'll all be different in terms of their points of growth, how they view life. And some of these things are also based or contributed towards by their background. Next. So some of the key facts from the World Health Organization again, approximately 12 million girls between 15 and 19 years, and at least 777,000 girls under 15 years of age give birth each year in developing regions. So that's a very huge number. At least 10 million unintended pregnancies occur each year among adolescent girls aged 15 to 19 years in the developing world. And there are complications during pregnancy and childbirth that are the leading cause of death for 15 to 19-year-old girls globally. So these are key facts that we really need to take note of as healthcare workers. Next. Other key facts: of the estimated 5.6 million abortions that occur each year among adolescent girls, again, aged between 15 and 19 years, 3.9 million are unsafe. This contributes to maternal mortality, morbidity, and lasting health problems, and also economic implications. Adolescent mothers, this is something that is no longer strange. So adolescent mothers between the age of 10 and 19 years face higher risks of eclampsia, endometritis, and systemic infections than women aged 20 to 24 years. Babies of adolescent mothers face higher risks of low birth weight, preterm delivery, severe neonatal conditions, and other adverse effects. So according to the UNFPA, despite gains in selected countries, little progress has been made in preventing child marriage in developing countries. So developing countries, Kenya being one of classified as that, and in the region as well, the sub-Saharan Africa. There are problems of girls getting married very early as even 11, 12 years old, and engaging in sexual activities that would end up in pregnancy, that impact on their health as well as their families, as well as society in general. Next slide. Next slide. So again, this map depicts that globally 1 in 3 women will experience physical and or sexual violence by an intimate partner, or sexual violence by someone other than their partner. And that importantly, such violence starts early in the lives of women, with estimates showing that nearly 30% of adolescent girls have experienced intimate partner violence. So there's also a psychological impact to all these sexual and reproductive health problems among adolescents. Next. So risk reduction approaches are important when addressing this issue, but they alone are not enough. So helping adolescents become aware of risks to their health, e.g. contracting infections like HIV and other sexually transmitted infections, teaching these adolescents how to avoid these risks, like to refuse unwanted sex or to have sex safely. So giving them the means to protect themselves, e.g. condoms and other forms of barriers, helping them if they experience problems. Because then, at the end of the day, if they fall victim of some of these situations, they should not be condemned. And some of these adolescents would normally approach us, whether we are community pharmacists or people working in hospitals or other areas, looking for help, desperate. Next slide. So the National Adolescent Sexual and Reproductive Health Policy 2015 has the following. One, it has several definitions of the ones that I picked for sharing is that adolescents, again, these are persons aged between 10 and 19 years. This shall be the working definition in this policy. Then adolescent-friendly services. These are sexual and reproductive health services delivered in ways that are responsive to specific needs, vulnerabilities, and desires of adolescents, and that these services should be offered in a non-judgmental and confidential way that fully respects human dignity. And the last point there is so important because, again, we all live in a society where judgment is something that is quite common, which contributes towards stigma, contributes towards fear, and allows other activities to come in, unchecked activities. Next slide. Uh, from the same policy, the policy and legal context is that several things have happened that contributed towards this policy. One, a ministerial commitment of comprehensive sexuality education and sexual and reproductive health services for adolescents and young people in Eastern and Southern Africa. That was in 2013. Convention of the Rights of the Child that was ratified in 1990. 1994, there was a program of action of the International Conference on Population and Development, and of course the MDGs, as well as the Maputo Plan of Action 2007-2010. So there are several other documents as well as guidelines or laws that protect the adolescent and allow healthcare workers to engage the adolescent in their sexual and reproductive health. The most obvious one is the Constitution of Kenya. Then we also have the Sexual Offences Act 2006. We have the National Youth Policy 2007, Sessional Paper number 3 of Population Policy for National Development 2012, and National School Health Policy 2009, as well as National Gender-Based Violence 2014. And this is also captured in the Kenya Vision 2030, among other provisions. So, to grow and develop in good health, adolescents need several things. One, information and skills. They're still developing. So, they need information, and information needs to come from somewhere. We all need to be informed, well informed, so that we can share this. Safe and supportive environments, because they live in an adult world. And some of them grapple, because this is a phase where there's a lot that is going on biologically, emotionally, psychologically. So they need a safe and supportive environment. Health and counseling services, they need a safety net. They need a place where they can be able to share, consult, or even approach anyone, just to ask questions concerning health, questions concerning their bodies, and so on. And we are the people who are charged then to be there, to be available when needed. Next. So again, adolescent sexual and reproductive health. So sexuality emerges during adolescence. And for many people, this is also a time when sexual activity begins. So this might seem like one of the lectures that we had in some of the subjects that we went through, whether it's primary or secondary school, home science, and so on. But it's so important to remind ourselves who these people are, because they walk into our facilities, yeah, and we need to engage them. We need to recognize them, and we need to understand their needs as refers to sexual and reproductive health. An important part of adolescent HIV care and treatment is assessing and responding to the SRH needs of clients. To be able to do these healthcare, so health workers must be comfortable talking about sexuality. They must be knowledgeable about the common sexual and reproductive health issues adolescents face and the services and information adolescents need. And we should be able to package it again in a language that is, one, digestible to the adolescents and palatable. Next. So again, other things to take note is that most parents are not comfortable talking with their adolescents about sex. Uh, Partly it's customs, partly tradition, it's the culture. Uh, sex talk is a taboo talk. But again, we must recognize the fact that when it happens to other people, uh, things happen to other adolescents elsewhere, then you'll find that a lot of people at that point are able to say things or talk. But that is not the case when people are feeling a bit uncomfortable talking to their adolescents about sex. Many adolescents think about sex, so those are facts. Health workers do not have to be experts on sexual orientation or sexual identities. So, a willingness to listen, understand, and refer clients to resources is what is required. So, as healthcare workers, again, we are expected to be very open minded, and create an environment where all our clients can come in and seek services. Yeah, seek services at whatever level. In Kenya, prevalence rates of many sexually acquired infections are highest among adolescents and young adults. So this is from the Kenyan National Guidelines for Prevention, Management and Control of Sexually Transmitted Infections of 2018, that early sex in adolescence is associated with multiple sexual partners, having sequential sexual partnerships of limited duration, failing to use barrier protection consistently and correctly, and having increased biologic susceptibility to infection and facing multiple obstacles to accessing healthcare. And when you look at some of the aspects that have been pointed out in these guidelines, it almost feels like it is adults that are being discussed here, but it is adolescents. STI management services must remain friendly to these young people, to these young population, and ensure that they are acceptable, available, and accessible. One, that they are friendly to these young population so that they do not feel scared, they do not feel like they're going to be stigmatized. Because when this happens, then some of the STIs have long term effects. They have long-term adverse effects if they're not checked. For example, syphilis. Next. So adolescents face these health problems for several reasons because they are unprepared and are unable to protect themselves, because they are under pressure to marry and bear children early. So again, culture and tradition. Because they are unable to refuse unwanted sex or to resist coerced sex. And because they are compelled to undergo FGM, which is still a very thorny issue. And we are, there are sections of our society that are still struggling with this, accepting the fact that we may need to look for other alternatives. And there are so many angles to it. There's political angles, there's cultural, and so it becomes a very sensitive or thorny issue to address, and requires an art. It's not just a qualification when you are addressing some of these sexual and reproductive health issues among the young population. It also requires an art to understand exactly how the society is, because again, we must accept the fact that with different backgrounds, adolescents will look at life differently uh, based on how they are brought up. If parents are open-minded, then you'll find maybe the adolescents are more open to having this discussion. But if they come from very restricted families, then these can contribute towards that. Next. So adolescent, again, sexual and reproductive outcomes among adolescents are determined by a web of micro and macro level factors. Individuals make choices to engage in specific behaviors. Family and community norms, traditions, and economic circumstances that influence these choices. Policy and regulatory frameworks that can facilitate or hinder some of these choices. So in 2019, there was a meeting in Nairobi, and this meeting came up with a statement accelerating the promise. And there are two aspects that came out from this meeting. One, zero unmet need for family planning information and services, and universal availability of quality, accessible, affordable, and safe modern contraceptives. The second point that we need to take note of, I think there were about six, so I just picked two and four that were relevant. Access for all adolescents and youth. Let's go back. Access for all adolescents and youth, especially girls, to comprehensive and age-responsive information, education, and adolescent-friendly, comprehensive, quality, and timely services to be able to make free and informed decisions and choices about their sexuality and reproductive lives, to adequately protect themselves from unintended pregnancies, all forms of sexual and gender-based violence and harmful practices, sexually transmitted infections, including HIV/AIDS, to facilitate a safe transition into adulthood. So this is quite important because it addresses very many aspects there. So the meeting actually took place in November, between the 13th and 15th of November. It was the International Conference in Population Development. So the Nairobi statement, where I pointed out two things there, formulated after 6 months of global consultation led by the International Steering Committee, with hundreds of organizations and thousands of people involved. This just provided a global framework for the formulation of government and partner commitments. And specifically here, we are saying that the adolescent sexual and reproductive health was a focus in the sense that We need to provide, especially girls, with a comprehensive, age-responsive information education and adolescent-friendly, comprehensive, quality and timely services, yeah, so that they can make informed decisions.
Mike, Dr. Mike,
Yes?
if I may just interject, as forgive me, I was saying that conference was timely because nobody knew we were going to have the year that we are having now, where the children are all at home. So it's good that we had that conference in November. Of course, no one foresaw COVID and children staying home for 1 year, but I think at least it will help us to push the agenda of adolescents, especially girls, of course, girls and boys. But especially for this year, it becomes a reality what that conference was talking about. Back to you.
Yeah, thank you, Dr. Jill, for that contribution. Yeah, I must say it was timely. I hope it was not predicted, but it was definitely timely. And we've had several reports about pregnancy among the adolescents or teenagers being reported in various parts of the country. And this is a clear indicator that something needs to be done. And as our role as healthcare workers, we need to come in and make a decision, very, very good decisions about how we can manage this. Because the pandemic, if we can blame the pandemic, the consequences are going to be long term. In fact, there was a report by the World Bank that said normalcy might return in 2025, whatever that means. Next slide. There was a study that was carried out in Kenya by Pamela Godia and other people, Joyce Olenja and other researchers. And this was published in 2013, November 2013. The study was about sexual reproductive health service provision to young people in Kenya, health service providers' experience. And it was trying to address the sexual and reproductive health service needs, of young people, and how health service providers respond to this. So there are very interesting findings. Please go to the next slide. Next slide. Yeah, so there was some very interesting findings there that we need to take note of. And it's just not taking note, but as we take note, we reflect amongst ourselves individually and even as wherever we are working. That one, the majority of health service providers were aware of the youth-friendly service concept, but not of the supporting national policies and guidelines. So that's a very interesting perception. You're aware of the youth-friendly service concept, but not supporting of the national policies and guidelines. So again, we have our individual reservations. And again, this is also tagged, like I said previously, to our own backgrounds, our own beliefs, traditions, and so on, which sometimes come into play as we provide health services. And as we evaluate how they come in, they can impact on health service provision negatively or positively. Yeah, and you'll find that some of the health service providers may decide just to sit on the fence about some of the issues and not touch on them. Second point is that health service providers felt they lacked the competency in providing sexual and reproductive health services to young people, especially regarding counseling and interpersonal communication. So that is so important because, again, as health service providers, we need to be ready to attend to sort of all cadres of people in society, young and old. And this particular group of people, adolescents, it requires quite a bit of, empowerment in terms of to improve your competency. to be able to counsel, to have interpersonal communication at that level and understand them, so that we are able to have a dialogue instead of a monologue. Society dictates that we tell people what to do, or we stop people from doing things. But the generations are changing. The adolescents are becoming more and more empowered, and just from experience, they almost seem like they know what they're doing, but sometimes that is not the case. Health service providers were conservative with regards to providing sexual and reproductive health services to young people, particularly contraception. Yeah. And then the last perception that came out from that study is that health service providers reported being torn between personal feelings, cultural and religious values and beliefs, and their wish to respect young people's rights to accessing and obtaining sexual and reproductive health services. So that's a very strong perception. And
True.
it's something that, as healthcare service providers, sometimes it's a very tricky situation. We may need to put some of our personal feelings and cultural and religious beliefs aside, which requires a bit of practice. It requires a bit of practice, and part of it is having a very open, so that you are able to engage these young people and provide the services that are required or expected. So the study was, so this paper was published in 2013 by Pamela M. Godia and others. Next. So the role of healthcare workers. Health workers have an important role in supporting adolescent clients to practice positive prevention. Health workers are responsible for providing accurate information about HIV and other STIs. So it's so important providing accurate information, because again, we can get caught up in some of the way
Propaganda.
people present some of these diseases out there without any scientific basis. Health workers are responsible for responding to questions about sexuality, future childbearing, disclosure, and transmission risk. So it is crucial that sexual and reproductive health support and counseling are provided in a non-judgmental manner. So there's a stress, we need to stress the fact that it has to be done in a non-judgmental manner. Next. So other roles of healthcare workers includes integrating sexual risk screening. So this again requires a bit of counseling, engaging the adolescent. And again here, let's keep in mind that based on the definition of adolescents, these are persons between the age of 10 and 19. And some of these adolescents join college or university or other tertiary institutions as young as 17 years. Yeah, as early as 17 years, so that by the time they actually get to 19, they may have experienced some of these activities. So integrating sexual risk screening, risk reduction counseling, and STI services in your practice. Sexual and reproductive health clinical procedures can be made more adolescent friendly through health worker client communication. So for example, by explaining the process, giving feedback in a non-judgmental manner, through respect for privacy and confidentiality, and through matching clients with same-sex nurses, pharmacists, or doctors, because some people might feel comfortable discussing certain things with certain certain genders. So that's something that we also need to take into consideration, and these may also contribute to missed opportunities among adolescents in seeking information and services when it comes to sexual and reproductive health. If it is pharmacies, community pharmacies, it could be also that we also need to provide a space where they're actually able to come and have discussions if they need to have discussions. Or if you have taken note of maybe a certain client who comes every now and then to take certain commodities, it could be the emergency contraceptive pills. We need to find maybe an opportunity to have a discussion of finding maybe better forms of contraception, or having just a candid discussion about um, sexual risks. Oh, next. So what you can do, because it all comes down to after all this. So what as healthcare workers, what are we meant to do? One is to increase your knowledge base on sexual and reproductive health. So that is the one most important point, to increase your knowledge base on sexual and reproductive health, so that you're ready for situations, ready for questions, and so on. Remember, I mentioned in the other slide there that we don't have to be experts. We just have to be ready to listen and have an open mind, and also have referral systems. So referral systems are very important, that if there are challenging questions or challenging situations, we know who or where to refer the client to. Training on reproductive health and contraceptive use is also very important. I know the Pharmaceutical Society of Kenya has been doing quite a bit of training on certain aspects of reproductive health and contraceptive use. We plan to continue doing that, but it's so important in the current state of affairs to access this training, yeah, in whatever form, whether it's even online training, and empower yourself, improve yourself in reproductive health and contraceptive use. Then third, documenting access to sexual and reproductive health services in your practice as parts of a needs assessment. If you're having more and more inquiries, or you're looking at how your commodities are moving and so on, do, we need to document that and do a needs assessment that can also guide in terms of, one, staff training. Do we need to train people in sexual and reproductive health services, so that now your practice or wherever you're working can actually be a point, can be a point of reference, one, can also be a point where these adolescents can come and access these information as well as services. And as part again of documentation, that also guides, in the wider context of things, society, as well as nationally. All right, thank you. I think that that brings me to the end of my presentation. And those are just some of the references there that that contributed towards this presentation. Jill, maybe you could, if you have something else to
Sure.
add.
Thank you, Dr. Mike. Thank you. Sorry for the earlier earlier struggle, but I'm here. Now, I wanted to stress some points, to agree with you and to stress some points. And I could say one of the biggest impediment to advancement of adolescent sexual reproductive health enhancement is the health worker. The health worker. That is me and you and others. Because even when we were undergoing the training for pharmacists on provision of health or family planning, the adolescent was always a very sensitive topic. In that, and one of the first point that you gave is that people do not know of supporting national policies and guidelines. So I could be doing something that is correct, but I feel I'm doing something wrong. And people needed to be convinced that, no, you are actually correct. And it's always conflicting. The laws are conflicting because, for example, somebody would say, you're not supposed to serve a child without the parent, isn't it?
Yes.
Yeah. But then there's always the conflict. What if the child comes alone to you and says, I am having sex, I'm not being raped, and I need contraception? So many people were conflicted because they feel like telling them, go and come with your mother. You see, go and come with your mother. You see, so health workers need to be trained of the supporting national policies and guidelines, to be informed and to know that it's the right of those adolescents to get care that of course is appropriate for them. So the health worker for me, even amongst pharmacists when we're being trained, in a room of 20 of us, 10 were confused and 5 were uncomfortable. Why are children having sex? But you see, the ABC of abstaining, sometimes, you cannot stick to abstaining, isn't it? Yeah. Sometimes the problem starts is that we are so stuck on abstaining. You should not be having sex. So now when you are the provider and you're stuck there, then there's nothing to discuss after that, isn't it? Because sex is already happening. So we need to be, and if you're not comfortable, if you feel, honestly, I cannot talk about sex and contraception to a child who is, I don't know, adolescent who is 15, 16, then you need to refer appropriately to somebody else who is less judgmental or you think can give better care. That's my take.
Asante, Dr. Jill.
Yes.
Okay, so from now henceforth, I stop sharing my screen and I request Rosalind also to share her screen. And ladies and gentlemen, we hold the questions for the moment. We are going to receive them on the Q&A section and we'll go through them all. Madam Rosalind, also, can you hear us from MSK? Perfectly well. So, ladies and gentlemen, this moment, I introduce to you Rosalind also to probably tell us what they do at Maristops Kenya. Rosalind, you have probably the next 10 minutes, yeah? 7 minutes in max. Asante.
Can you see my screen?
Yes, it is visible.
All right. Hello, everyone. Thank you for this opportunity to present about what we do, and particularly what has worked for us when it comes to the adolescent health. Just a brief background of Maristops Kenya. We're a sexual health and reproductive provider dealing with post-abortion care, maternity, and women health services across Kenya. And we do this through various delivery channels. We have got clinics, 19 of them countrywide, plus an obstetric center. We have got outreach teams that serve within the rural and peri-urban areas. We have partnered with private providers going by the name AMUA. And we also work with government health facilities and partnerships with the various pharmacy outlets. Our impact in 2019, we served over 1.3 million women with SRH services. And amongst that, we have also served over the past year, over 300,000 youth through those platforms cited with counseling and reproductive health services. And so that promise that now we give women and girls is something we see as unique because we want to build for them a better future for themselves and their loved ones. We want to have a network. We actually have a network of caring professionals across Kenya, delivering women wellness services. And of course, this is now will enable them overcome their challenges and thrive throughout their lives. So what we offer is that we know that we have to reach the youth with the various services. So it's right from the participation in community services and even various places where we can get the youth so that we can counsel them and call them in for testing or any other service that we provide in that range of services, ranging from sexual health counseling to the consultation. It could even be a gyna issue. So we also have gynas who they can consult with. We give them the contraceptive methods because now that is the issue at hand about the teenage pregnancy. We also offer the pregnancy crisis counseling, the post-abortion care, of course, the STIs and HIV, and also other services such as lab, pharmaceutical services, and ultrasound. One of the things I wanted to emphasize on is what has worked for us since 2016, when we looked at the adolescent, we really immersed ourselves into the adolescent reproductive health. Since 2016, when our proportion of these adolescents was actually at 4%, but that has since grown to 30%. And this was through now a program we adopted. We had a partner called IDEO.org, where we developed a brand called Future Fab. This is targeting the youth through the use of human-centered design. So we have aspirational centered messaging, whereby now we celebrate the aspirations of the girls, and as we focus on what contraception would do in their life, as a way of also helping them protect their future. But of course, to reach this youth, you need to have the buy-in of the community. And we have noted that parents play a big role in terms of influencing right from that bit of the community, because they're part of the community, and now to other community gatekeepers. So we also need to reach them. As much as we want to talk to the adolescents, we also want to talk to the parents and the rest of the community, because so that when this girl is going in for services, when she's saying that she has a problem, she has got the backing of the community and even their own parents. So we've had a few cases here and there whereby you have provided these services and a parent comes and protests because probably they do not have the knowledge of what is happening. They do not know about the adolescent reproductive health policy that allows these young people to access services. And of course, now this young people, we know that they won't just wake up and come to us for the services, whether it is through our outreach or within our centers. We use mobilizers, ranging from the young mobilizers to now the traditional community health volunteers, to actually bring them, maybe escort them for services and promote that counseling right from the community level, right to they will receive the services at the facility. Then now the big thing, which at least it was mentioned within the previous presentation, about having discreet, friendly, convenient services. We have trained our providers to be youth-friendly. So one of the, as they come in, part of the induction is also training them to be youth-friendly. And not only the providers, actually everyone within the setup where the services are happening, and of course also our mobilizers, so that they can be able to access these services. And through different donors, we have also been able to provide free services for the youth, so that they're able. We know that some of them are not economically able, and they may not be able to approach their parents so that to pay for services. So we have gotten the privilege of having some grants which have been able to cater for the adolescent services. So of course, with the youth, they're also quite big on social media, particularly within the urban setup. So we do have a contact center whereby they can call. There's a toll-free number. They can also reach us on WhatsApp. There's also Twitter and Facebook. And what we have noted, particularly during this COVID period, our WhatsApp and Facebook chats have really gone up with, of course, different queries. And we use that to now direct them to where they can be able to get services. And our partnerships, of course, has also continued with the pharmacies, so that we are able to provide right from the self-injectable cyana, and onto other range of products that would actually now ensure that access is also available, not only at our centers, but also within the pharmacies. So thank you very much. I hope I have kept within the time that was given. And you have also benefited from the presentation. Thank you.
Asante, Asante, Madam Roslyn also. Thank you very much. Probably you have even touched on some of the questions that you have even touched on some of the questions that the members are asking. So, to be able to appreciate our sponsor for this event, I'm still at the Maristop side, and I'm reaching out to Dr. Juliet Conje from Maristops, who also doubles up as the head of treasury at PSK, to probably say hi and asante just before we go to the Q&A. Dr. Conje?
Can you hear me?
Yes, I can hear you loud and clear, Dr.
Okay. Good evening, everyone, and thank you for joining the webinar. We thank PSK for enabling Maristops Kenya to, give insights on access to reproductive health services to our young women in the country of Kenya. So thank you very much. I don't want to talk. Roslyn has given us a full presentation. Please feel free to reach out to Maristops. We have Roslyn has showed us the contacts, how you can reach us. Yes, and let's continue serving our adolescents. Thank you, Mbao.
Asante sana daktari, and sauti yangu iko salama, ni mate nilimeza kwa mbio kidogo.
Yeah, I got scared for a second, so I had advised Mbao to probably get a COVID test done.
Asante. So ladies and gentlemen, without further much ado, it's now 7:58. I want us to spend probably 10 minutes on the maximum, 10 minutes on the maximum to respond to questions. The first question is from Sharon and Eva. Will CPD points be awarded and how? Sharon and Eva, if you're a pharmacist, CPD points are going to be awarded to all PSK members, and you're all requested to subscribe on the PPB portal. It is now up and running. So I request you probably to subscribe on the PPB portal, and it's you're going to be able to get your CPD token later on, probably in the course of the week. Also for pharmaceutical technologies, kindly remember to subscribe to the event. For other cadres, kindly on request, you can be able to email us at, you can email me on communications at psk.or.ke. I will be able to assist you how to get your CPD points. There's another question by Caleb Wire. For young people, there is a misuse and overuse of P2. It is clear that most do not know how to use it, but when you try educating them on the use, they feel judged. Is there a public education to enlighten them about proper use? I will throw this question to Dr. Jill Mutua, who has told us now we need to stop with the abstaining part. These guys have already learned the act. Let's now move to protect the act. Dr. Jill Mutua, are you able to respond to that question?
I am. And just to correct you, I have not said we should stop abstaining. I'm just saying we need to open our minds more, that even after abstaining, there's life after abstaining. That's what I meant. So I'm not misquoted to be promoting sex. Now, to P2, back to P2, the thing about P2 is that frequent use is not advisable because it fails. With time, it fails. and then it messes up the whole hormonal balance, such that later you find that a female is not able to know when she's ovulating, she's not able to know when she's safe, when she's unsafe, and then it becomes like a heroin. It's something she takes every time she has sex, which is wrong, because you find that overuse of P2 messes up the system, yeah. But the information about proper use of P2 should come from us. We are the ones to authoritatively, because where are they getting it from? They're not getting it from school. They're getting it from us. So you have to be authoritative. And for you to be authoritative and imperative, you need to know what you're talking about. So you need to be informed that the moment you friendly advise a youth that the moment you need more than 2 P2 in a month, please move to COC. Yeah. The moment you need, you have to be trained yourself, or you read yourself, so that you tell them when you know, they always behave like they're not listening to you and no, you're the one who is holding it, isn't it? So you have the power, and the power will come from you knowing what you're talking about, for you to be imperative enough that the moment you need more than P2 in a month, please come for Cox. That is how it's supposed to be. Okay, over to you.
Maybe I can just add.
Okay, Doctor.
So one, I think just addressing the pharmacists and the pharmaceutical technologists, we have a professional and social responsibility, yeah, to educate and empower the public, especially young people, on sexual and reproductive health. You know, discussing about treatment, discussing about prevention of STIs, HIV, and other things that come with sexual health. There was another study that was carried out, and this was, I think it's very interesting because it was trying to probe or trying to find out whether pharmacists provide youth-friendly services, yeah? Whether they provide youth-friendly services, especially when it comes to barrier methods, condoms, and emergency contraceptives, in Kenya. It was published this year in May. And some of the things that came out of it is one, which was very interesting, that one, counseling by pharmacists and pharmaceutical technologists was sporadic. It was rare. It happens, sometimes it doesn't happen, yeah? And sometimes when it happens, it's not accurate. So that is something that we need to take note of. That's why I said we need to increase our knowledge base. But strangely, young people feel satisfied with a quick transactional interaction with pharmacy personnel. So if they can actually walk in with a tiny piece of paper, which they probably have written P2 just before they walked in, if they can get whatever they need to get as quickly as possible, then they feel satisfied. They feel like, yeah, we're getting what we want. So this this study, but eventually this study also concludes that, the transactional interactions between pharmacy personnel and young clients appear to be youth-friendly enough. But we need to strengthen these services. We need to improve these services, yeah, so that we expand the scope, just like Dr. Gila said, so that we are able to provide options, and not just to provide the commodities, but to provide information about these other options while screening for other things, yeah, screening as well as counseling, because it's only through counseling and discussions with these adolescents that we can actually understand exactly what they want or need. And with the knowledge that we have about the commodities that are there, then we can better serve them. Bao?
Asante, Dr. Mike Mongoma. And the conversation that is coming up here is from you, Dr. Mongoma, is the pharmacists need to live up to their professional expectations. It doesn't end that by just giving out the drug. Doesn't end out there. We need to ensure that the patients are utilizing all drugs given and any other medication or medical devices to the best of their ability. Thank you very much, Dr. Mungoma, for that. I want to thank all our presenters for today, Dr. Mike Mungoma, Dr. Jill Mutua, our sponsors and main guests, Rosalind also and Dr. Juliet Konje. Ladies and gentlemen, I'm 1 minute past the time. I can see Philip Nandi from Siaya is saying that it is raining cats and dogs. Philip, hope you have been able to get something, even though it was raining cats and dogs. Hope you gotten something. So, ladies and gentlemen, kindly remember to subscribe to the event on the Pharmacy and Poisons Board portal. All other cadres are told they can be able to write to me upon request. We are going to issue with them a token that they can claim the points. Without further much ado, ladies and gentlemen, have a great evening. But before you leave, this is part one. We're having 3 parts training on reproductive health. Dr. Jill and Dr. Mungomo are well prepared. We shall be having our next webinar on reproductive health on 20th. The next shall be on 25th. Ladies and gentlemen, kindly look out to all our communication materials because we're having close to 8 to 13 webinars, under which you can be able to learn in the course of November and early December. I have been your host and moderator, Mbao Gitao Alamsiki.
Good evening.
Thank you, Bao.
Okay,
Good
thank you.
evening. Bye.
You.
Thank you.
Bye.
Bye.